Good afternoon, ladies and gentlemen. We are here this afternoon for a very, very important panel, Public Health in India, Critical Issues and Challenges. And it's really an honor and privilege for me to moderating a session with very, very distinguished panelists. I have with me Mrs. Preeti Soodan, Secretary, Department of Health and Family Welfare, Government of India. I have with me Mr. Bekidam, WHO representative in India, and Dr. Bajaj, who's chairperson of Cygnus Group of Hospitals, a huge chain of hospitals in the private sector. Let me tell you at the very outset, public health, like I mentioned in my opening remark this morning, is a very, very important determinant of Human Development Index. It impacts human resource development. It impacts productivity of a nation. And currently, India is in a transition, economically, demographically, epidemiologically. We have also very recently made a policy under the National Skill Development Mission that India is going to train a huge force of nearly 500 million people by 2022. We can only benefit by this demographic dividend if this workforce is healthy and continues to sustain to be healthy. Secondly, in health, I find kind of a paradox in India. You know, broadly, we have public domain and the private one. In the public, we look after primary health care, secondary and tertiary. In the private, it's broadly the secondary and the tertiary. But why I call it a paradox? That we run the world's largest anti-TB program. And if I tell you the figures, mind-boggling. In a span of just 12 years, we treated more than 18 million people, more than population of 5 Norways. It's huge. It's not easy task. But our problem is also we are 1.3 billion people. We have to see everything with that backdrop. Then, apart from this, we've been able to totally eradicate polio, guinea worm, yaws, tetanus, and even infant mortality, which was troubling us till 7 to 8 years ago. It was quite bad then. We've been able to, it has declined radically in the last 3 years, and we've been able to bring it reasonably under control. Let me tell you, medical tourism is worth $100 billion. It's going to be $280 billion 2 years from now. We do surgeries in India at 1/5, 1/10 of the cost. People from UK, many parts of Europe come to India for surgeries because there's a huge waiting period of 6 months to 8 months in many countries of Europe. So all this is there. And besides that, I think a lot of work has been done in the government in terms of redefining the national health policy, and for which Mrs. Soodan's effort can be attributed to. And particularly last of the initiatives that have been taken by the government is that Ayushman Bharat initiative, targeting 10 crore people. It's the largest healthcare insurance in the public sector, attempted anywhere in the world. It is going to give benefit to 50 crore citizens of India. So I would like to compliment Mrs. Soodan for having been not only party to it, having pioneered and having been largely instrumental in designing this initiative. But the downside, sadly, we lose 1,500 people every day because of tuberculosis. We lose 1,200 because of diarrhea, which we do not really say it's much of a disease, it's just a condition today. And the infrastructure in health is up to its seams. And sometimes I wonder that in the coming years, to meet the challenges of the 21st century, this infrastructure is adequate or not. Are we building on it? Thirdly, where are we in terms of our dream of universal health care? Are we in the process? Are we in transition? When are we going to reach that milestone? And how are we going to handle primary health care? Because some of our gray areas or bad areas are primary health care. We've done phenomenally well in secondary and tertiary health care. Particularly rural India continues to be bad. There are issues of shortage of doctors, quotient of availability of doctors per thousand, sometimes even less than the global average. Number of beds per hospital, particularly in the government hospital, is also dismally low. What are we going to do about it? What are we going to do about the private sector? Are we going to engage them? How do we propose to engage them? What kind of model are we anticipating? So these are many of these issues I would expect my panelists to throw light upon. I would first request Mrs. Sudan, our Secretary Health, because we would like to listen to her, what the government intends doing. Thank you, ma'am.
Mr. Dalbir Singh, ever since I've known him, I've really wondered how and where he gets all this zeal to do the kind of social work on a voluntary basis that he does. I'm so glad that India has people like him. Dr. Henk Bekkedem, he is, I would say, my comrade in arms in whatever we do. Dr. Bajaj, and the distinguished audience that is here. Ladies and gentlemen, thank you for having me here. I just want to say that the context has been very aptly, I think, set out by Mr. Dalbir Singh. First and most important is our population. We have a huge population. Whatever we do actually makes a difference to the entire world. So therefore, we are always the focus. And sometimes when I see these reports, they say the highest incidence of TB, the highest incidence of this disease. Actually, it means nothing, because you see the percentage of people, because we are many countries in one, I would say, and also this implies the kind of diversity we have. If you look at our country, there are some indicators in which our states, some of the southern states, the northeast, and even the western states are better than the most advanced states. But in some, we are worse than Africa. So therefore, you see, this is the first public health challenge as secretary that I face, the diversity, because one size doesn't fit all in our country. You have to have state-specific strategies. You have to have a consultative process. Now, if you see there's recently a report which gives us a comparison of global disease burden between 2007 and 2017. So if I look at that, I'm sorry, I should have got actually that one slide for you to see, which was very actually enlightening for me also. Neonatal deaths out of diarrhea, pneumonia, lower respiratory diseases, still are the big killers. But if you see the fall for India, there is 39%, 40%, even TB, 21% decline in incidence. But what is happening? Ischemic heart disease, for example, NCDs, they are becoming the major killers now. So 62% deaths are because of NCDs, and out of them, 55% are immature. So given this scenario, our public health strategies also need to change. Now, you have asked me to talk about the challenges. I would say, if I have to sum up my challenges, then there are challenges of quality, challenges of equity, and challenges of reach. And amongst them, there are a whole lot of, the multi-sectoral, cross-cutting issues that health as a paradigm faces. Now, I just want to start with that our vision in the health, National Health Policy of 2017, as you saw, was basically, health and well-being for all. So the word well-being was added. Very quickly, we moved to, from a policy to a program. If you saw last year's budget, then you see since then, health has been in focus. Ayushman Bharat, an umbrella scheme which encompasses primary, secondary, tertiary health has been put in place. It's not just the whole paradigm of health that is being now addressed, but it is also that we are looking at preventive, promotive healthcare in addition to the curative, as we have always been looking. See, in India, for us to be healthy is that we get medicine, we get treatment. But health is more than that. So that is why the well-being or be fit or healthy India, that is now envisaged and that is the vision. But it is not just a vision, it has been translated into a program. So if you see Ayushman Bharat, it has two pillars or two components. So there is this health and wellness centers which we have to set up about 1.5 lakh health and wellness centers by 2022. This year I'm setting up 15,000. When I say this year, then it is the financial year, that means by March 31st. I have already put in place 10,000, but I am saying I have put into place 7,600. Why am I not saying 10,000? Because we are not compromising on quality. There are some parameters which have to be met for the health and wellness center. There has to be a mid-level health provider. There has to be free drugs and diagnostics there. The ASHA workers, our field force of health, has to be trained, and you see the requirements for preventive screening have to be there. So what is different in these health and wellness centers? I'd like to explain to you that under public health, as I said, and as I also mentioned when I spoke about the global disease burden, was that we concentrated on RM and CHA, which is reproductive, maternal, new child born health, and for adolescents. So we were not covering a major part of the population, and also not a life cycle approach to healthcare at the primary healthcare. Now, under Ayushman Bharat's health and wellness centers, we are doing preventive screening for everybody who's above 30 years of age. And mind you, it's a mind-boggling task. 15,000 health and wellness centers means I have to do a survey of, the population or the catchment area of all the people who fall in that health and wellness center. So approximately it's about 8 crore people. I've already done for 1 crore. Now I would like to also say that in setting up of these health and wellness centers, we have different models. Like Andhra Pradesh, for its urban areas, has a tie-up with Apollo. Then Karnataka, Gujarat, Karnataka and Northeast has a tie-up with Karuna Trust. Then there are some people who have actually charitable institutions are looking up. I have also told states to look at CSR. So, but whenever we are going in for these partnerships, there is a baseline which has to be met, which means our national programs of immunization, of TB, and of, whatever our verticals are, they cannot be compromised. Dr. Dalbir Singh spoke about TB, and I must congratulate him that he's been our partner, helping us with our efforts to TB. But over this last 1 year, I'd also like to say that there has been a lot of initiatives from the government side. We are now giving monetary nutritional support through direct benefit transfer. We have also brought these TB drugs into H1 schedule of drugs of our law, which means that necessarily there is a separate register to be maintained by the chemists, and now we are making it online. Today, I had this meeting of drug controllers across the country. The other pillar of Ayushman Bharat, which is PMJ, which is receiving a lot of visibility now. Already our successes are in public domain. We have been able to cover lakhs of people. We have helped them from falling below poverty line, because government has become a payer of services. We used to earlier be a provider, but now we are compensating. And I must thank and appreciate the private sector hospitals who have come forward, and I urge many more to come forward. The process is very simple, it is online, and you see the kind of visibility that we are receiving also makes a poor person confident that he can get good medical care. So together, PMJ and health and wellness centers are, I would say, game changers for health in India. Now, I was speaking about equity, I was speaking about reach, and I was also spoke about quality. Now, you see, in the private sector, about 62%, that is one estimate says, beds are vacant. In the government sector, as Mr. Dalbir Singh also said, that we do not have enough beds. So if we partner together, we can actually make a difference, and that's what we are trying to do through PMJ. Another thing is that in the tier 2 and tier 3 cities, we do not have infrastructure. So for that, we have recently announced a policy of incentivizing private sector to set up hospitals through land pooling, through viability gap funding from a scheme of DEA, where hospitals are also categorized to receive that kind of help. There is also, automatic FDI route which is given. So these are the various things that are being put into place to encourage private sector to be partners, not only in metros and big cities, but also in the tier 2 and tier 3 areas or cities of our country. And another thing is that, the leveraging technology, that's very important, because we do have, Dr. Begdam will say that we don't have enough doctors, I agree, but I'd also like to say that your ratio of 1 doctor to every 1,000 population, is it? So, but Kerala and Tamil Nadu has 1 doctor to 938, so which is even better than the WHO, standard. So that's why I said India is many countries into one. But then, so that is why the kind of reforms we have brought into medical education, we have actually relaxed that. Earlier they used to say that for every PG seat, 1 doctor cannot take more than 2 students. We have relaxed it to 3 students. We are moving towards outcome-based, a medical education model instead of infrastructure. China doesn't have the kind of big, medical colleges with so much of land and infrastructure required. India does. So we are also trying to do that, and also dialogue with people on what they want. So thank you very much for hearing me out. And
Thank you very much, ma'am. Just quick couple of questions. You can answer them towards the end. I'll hand over the mic to Dr. Bakidam. One is, we have the lowest spending in terms of our GDP for public health, 1.3%. It's very meager. Our friend here from the WHO says we should have 5%. Where are we in terms of attempting to increase, where is our endeavor? Do you see in the foreseeable future we do something about it? Secondly, I'll give both the questions, you can answer later. Now, second is, over the years, what has troubled me is that there is far too much emphasis on curative medical care. We've forgotten. In fact, we treat preventive health care as an orphan. Maybe in 60s and 70s, there was a lot of preventive health care. And now with communicable diseases, as well as even the non-communicable ones, lifestyle changes, new pathogens coming, there is a lot of scope for preventive health care. We have to shift our focus. If we don't go back to preventive health care, we'll reach nowhere. And these are the 2 questions that have been troubling me quite some time. Now I'll hand over the phone to Dr. Bakidam.
Thank you.
oh, you have to answer in the end. Why don't I answer now and get over with it? Acha, see, the preventive promotive part, I answered, that is the paradigm shift. So health and wellness centers are addressing that. And FSSI also is involved with us. The Eat Right movement is that kind of a shift, and also engaging communities in it. Then as far as your GDP, your spending is concerned, we have a 17% increase. And let me tell you that now we have extra budgetary resources also. So we have what is called HIFA, Health and Education funding mechanism, which is based in HRD, where we raise a soft loan for our aims, for our medical education institutions, for the upgradations that we do, for the, all the special super specialty blocks that we create. So I think we are getting there, though it will take some time. But it's not just about spending, it's also about absorption capacity. How much funds can the states absorb? So we are increasing that absorption capacity through PMJ, through health and wellness centers, through medical education, and I'm sure we'll get there.
Thank you very much. Mrs. Dalby Singh, it's an honor for me to be with you on this panel. I think you've been a true champion of health and public health, and I think it's great to be over here. Ms. Priti Sudan, it's great to work with you under the leadership in the Ministry of Health, together with the Minister of Health, Mr. Sushin Bajaj. I think it's great that people like yourself are also in this panel, because we're talking about improving health. And like also the Secretary was mentioning, this is not only a government issue, that needs also to be done with the private sector. So it's great to be over here. Going back to your questions, and indeed, I'm now more than 3 years old in India. I've worked for over 20 years in Asia, and some of you might have followed me. When I was the first year in India, I said very clearly I wasn't shy, and it didn't matter who was sitting next to me, I really felt that health was not on the agenda in India. And India had not been investing enough in India. But I can tell you, after being now for such a time over here, I can see that many things have been changing. The National Health Policy Document 2017 is now committing itself, and has been approved by the Cabinet, to start, instead of the 1.2%, now moving towards 2.5% of GDP by 2025. We still hope that it will be a little bit earlier, but nevertheless, that commitment is there. And I think that is great. To have now health on the agenda is extremely important. Looking at a few things from what's happening now, I think an issue is for sure, and myself, I worked in other countries too. I worked in China, and by the time I came, it was only also 1% of GDP was spent in health, and they're spending now 3.5% of GDP on health. Health was not on the agenda, but SARS got it on the agenda. Now India is in the phase that it gets on the agenda, and I think what the Secretary is saying is absolutely right. Just spending more is not always easy. Absorptive capacity is an issue, but also if you start spending it on the wrong things, then you don't get value for money. And I think that's one of the big challenges what I think we are having now. And that links also very much with the question and some of the comments earlier made. We as WHO, we still feel that where government money should be spent mainly is where the private sector, where the market mechanism has little value. Now, I can tell you the market does not like to be in very remote areas. Can you remember when in the UK, when they start privatizing the railways, the first services was stopped in remote areas in England. This is something what we know from the market. So the focus on health and wellness centers, the focus in rural areas is extremely important. So these are some of the issues that we need to look at. And one of the absorptive capacity has to do with human resources, and some of the issues were already mentioned. If you look at human resources, there are 4 issues what you normally talk about. It's the numbers, it's about the distribution, it's about the mix, and the quality. Now the numbers have already been mentioned, and I think in certain states, indeed, the numbers are not bad at all. In some states, the numbers are bad. But one thing where India is also suffering from, and where many other countries are suffering from, is distribution. Tell me any country where a well-qualified doctor would be ready to work in a remote area. That is not happening in India, that is not happening in other countries. And therefore the policy to make sure that mid-level cadres are there, that they are also the first contact and provide quality services, extremely important. There are a few things in health which is not necessarily, like when you have a flu, it's okay. But there are few conditions, if you do not get the right services in the first hour or while you move towards a district hospital or a primary healthcare center, it can be really very bad. A child with a pneumonia, if the child has to travel another 8 hours to the next place where it can be treated properly without being given antibiotics while it's traveling, can be dead on arrival at a district hospital. There are a few areas where really we need to make sure that we have the first level care that is done well. What is of course the case, the distribution part has been challenging. And one reason is that because in the past you might not have had the right staff over there. Now you need to make sure that the community understands that there is services being given. And that whole issue about quality, I think, is a very important part of the health and wellness centers too. If you just put health and wellness centers and you open them, and you have not put your staff in there, you don't have the antibiotics and the drugs over there, then for sure, then people will be as disappointed as they were before. The building might look nicer, but if you don't get the services needed, then for sure we still have a challenge. Now, another area where the government, so the HR, on the HR issue, the other issue which I feel passionate about, and some people in the audience also, and I know that the Secretary also does, is public health. If you look at the cadres, we have in Tamil Nadu, we have a public health cadre. Maharashtra has also. But actually, if you look at the whole country, public health cadres are not there. And public health is something that people should be proud about in working. It should not be those people who failed in something and then end up in public health. There should be a career in public health because there's a lot to be done over there. And I think these are issues which I think the government is also looking at it. If you look at the other issue about quality, I do appreciate very much that there's now the training on with also the medical colleges is enormously other issue. Now the second part, and it was also one of the subheadings that you had in your talk, where the market is not so interested is in equity issues. At the end, I think this is a government where they need to come in. In India, as you all know, for many people who were not poor before, they went into poverty paying a healthcare bill. And many of you in the audience also know, when some of your relatives are ill, then often you have to start chipping in to make sure that some services are being done. And if you don't have relatives to do so, then it's a problem. But I will also tell you, I worked in Cambodia, I worked in China, I was there also the WHO representative. The single most cause, like in India, to go in poverty, meaning that you were not poor before, was paying the healthcare bill. So this is something which is happening. Now with the vision on Ayushman Bharat, which has the health and wellness center, but also the financial protection, that's extremely important. And what we have seen, the PMJ goes beyond only the poor. It goes also to those ones who are vulnerable. And this financial protection is extremely important. And this, for instance, the surveillance system, what has now been set up under the leadership and also the vision in the Ministry of Health, is so much better. Before you had a surveillance system where somebody was reporting on paper, just like Madam Sudan is now doing to the chair, and then it had to go up, and it could take days before anybody knew what was happening. Now we're moving to a real-time web-based reporting. At the moment that you report over here, everybody at all levels is informed. And that is needed. When you have an infectious disease or especially an outbreak, then you can't have delays. Now, some of those things are extremely important, and we're very happy as also WHO to continue supporting. I think I'll have to rest also.
Thank you, Dr. Bagdam. We just have to wrap up soon, and I think just about 2 minutes, I would request Dr. Bajaj to spell out as to what can really be done in the private sector to meet some of these challenges. Just restrict yourself to your role there.
Thank you very much, Major Dalbir Singh. I'll be very brief. Just the problem with the private sector right now, and that is being accentuated by the insurance-based schemes that are now getting into India as well, is the problem is that the incentives of the doctor and the patient are completely misaligned right now. The doctor is paid when the patient falls sick, while the patient's incentivized to stay healthy. So I run a group of hospitals in the small towns. And every time we open a heart care center with a cardiac cath lab in that town, the entire town aggregates together for the inauguration. So I ask only one question. Would you rather have a heart attack and be treated very well by us at this center, or would you rather not have the heart attack at all? Unsurprisingly, the answer is always number two. Nobody says, I want to have a heart attack and be treated well by your hospital. But the problem is my cardiologist does not have the time to talk to each of them for their healthcare activities, for their diet planning, for their exercise. So the preventive aspect gets completely lost in the hustle and bustle of everyday sick care, and it's not really healthcare. We just do sick care. The problem is when the patient is really complicated, he comes to us, and we forget about the actual costs of the disease that he brings with us. See, when a diabetic patient comes to you, the government has very kindly said that you will have free dialysis facilities in all districts. But we forget that the most common reason for kidney failure is diabetes. So a patient comes to our hospital with a diabetic foot, and we need to amputate that foot. The direct cost of that procedure is only about 20 to 25,000 rupees, which in itself is a big cost for that person. But we forget about the indirect cost of the disease, because then he goes back and he loses his job. So he's bereft of earnings for his next life. The entire lifetime is gone. And then even bigger is the intangible cost of the disease. Now, because he's lost his job, he pulls out his children from school and sends them to work. So generations get spoiled because of this disease, which we forget to see. So the primary care, the preventive care is of utmost importance, and that is why I feel that in Ayushman Bharat, although right now the headlines are being gathered by the insurance scheme, by how many procedures have been done, we were the first in India to do an angioplasty of an Ayushman patient. It was done at our hospital. We were also the first to do a mitral valve balloon closure for an Ayushman patient. But those become a lot of headlines, but the real evidence of the Ayushman will come from the health and wellness centers when they are successful and when they focus on the 80% of the healthy population rather than the 20% of the sick population that we keep working on right now. Thank you.
Thank you. Thank you.
Thank
For
you so much.
1.3 billion people wanting to be healthier, we should have at least one hour of debate. I'm sorry, my convener allocated only 35 or 40 minutes. And thank you all my panelists.